going to do the intro, though, right?
Yeah.
Yeah, okay.
Okay, 5, 4, 3, 2.
Hi, I'm Dr. Victor Harry, a practicing internist in Clinton, Maryland. I am supporting the Testamillion patients for diabetes mellitus. The reason for that is because diabetes is very prevalent in the society. And as a result, there are many complications which results from the presence of diabetes mellitus. So it's important that persons who have family members who are diabetic do check themselves to ensure that they're not diabetic themselves, because it takes approximately 10 years before that could be recognized, whereas when testing, it can be recognized at the very early stages.
Okay, now, he's going to look at you the whole time.
Yeah.
Right? Okay.
I'm looking away from the camera now.
You're looking at me as if we're conducting the interview.
Oh, okay.
Just wait. Okay.
Dr. Harry, could you tell us exactly what is diabetes?
Now, diabetes is a disease in which...
Okay, cut. He's going to look at you.
You're gonna
Oh, look at you, not over there.
Yeah,
Okay.
We're conducting an
Okay,
interview.
all right.
Tell our audience exactly what is diabetes.
Diabetes is a disease in which sugar or glucose accumulates in the bloodstream and does not get into the cell proper. As a result of that, what happens is that fluid is removed from the cells and more fluid enters into the bloodstream. That concentration of blood sugar into the bloodstream constitutes diabetes.
There are at least two types of diabetes. Could you tell us the distinction between?
Well, there are
those
two types of diabetes, type 1 and type 2. Type 1 diabetes is usually insulin dependent, and the person is in most cases born with it, where there is some problem with the pancreas in terms of destruction of the pancreatic cells, the beta cells of the pancreas. On the other hand, type 2 diabetes usually occurs in an adult stage, or in persons, now we see it in younger children, in persons who have taken in so much product that yield to increased blood sugar that the body cannot handle it. As a consequence of that, what we find is that the body becomes overloaded with sugar, and the person...
Oh, that's okay.
We could always add to that.
That's right.
Yeah. You can start with, and the consequences of that are.
Yeah. Yes, what happens then is that the body becomes overloaded with blood sugar in the vasculature, and as such, the sugar rises. So that happens in cases of too much eating, too much intake of carbohydrates, and not enough exercise.
Very well. What is diabetic retinopathy?
Now we're moving very quickly into sort of the result of too much sugar, or the result of diabetes for a long time. Now, retinopathy basically is damage to the retina. The retina is in the eye. It's the part of the eye which is responsible for vision. So when the sugar in the bloodstream becomes increased over a long period of time, the sugar enters the cells of the retina, and as a result, the cells are destroyed. And there's an accumulation of increased vasculature, which means tiny vessels are formed. And these tiny vessels sometimes bleed. As a result of the formation of these tiny vessels, then we have the destruction of the retina. It is usually very silent, and sometimes the person never recognizes the presence of decreased vision. However, they may just see some cloudiness, and when investigated, would recognize then that by the ophthalmologist or the optometrist that there is some destruction to the retina.
Can diabetes cause cataracts in a person's eye?
Well, I may answer your question this way. Now, people with diabetes have 5-fold a greater incidence of cataracts than the normal population. What is believed to happen is that because of the presence of the high blood sugar, the protein in the lens of the eye changes, and that causes some thickening of the lens, which is a cataract.
What is the connection between salt and hypertension?
Turn that off.
It's not.
Oh, it's not on.
Oh,
Oh,
no, this is on.
yeah. What I was just saying. Hold,
No, we have
hold.
plenty of-
Yeah.
we have plenty of-
No, because
Diabetes and cholesterol.
people who do have diabetes tend, in some cases, to have high cholesterol. In many cases, that's the result of genetics or dietary intake. So the connection per se is maybe more habit forming based upon the person's habits. Diabetes does not necessarily, what can happen, however, people who have diabetes may have high triglycerides. And that is an indication of course, which results in the blockage of the tiny vessels of the body. Yeah.
Okay. Is there a connection between diabetes and hypertension or high blood pressure?
I think, phrase it the other way.
I've noticed that there are a number of people who have diabetes also have hypertension. Is there any connection or link?
There is a connection and there is a linkage, and it is not necessarily a direct one. For instance, diabetes may destroy the person's kidneys, and as a result of the diabetic effect on the kidneys, that person may develop hypertension. It at one time was believed that diabetes and hypertension may be one and the same type of disease, but not truly a direct connection. But we must note that persons who have diabetes over time would have hypertension. Not necessarily people with hypertension might have diabetes, but because of the prevalence of both in the population, we find that the same person might have both of these diseases.
How can diabetes damage the coronary arteries, and can such damage lead to a heart attack?
What diabetes does, it interferes with the vessels of the system, of the body. It begins first with the tiny vessels. Now, the inside of the vessels, which is referred to as the endothelium, that lining of the vessel is destroyed by the diabetes. Now, as a result of that destruction and the formation of atherosclerosis, the vessels become blocked. Now, when these vessels become blocked, then one finds that at the end of that vessel, there's no oxygen carrying capacity to the muscles. So if that's the heart, the person might end up with a heart attack. Or if that's the limb, the person might end up losing the limb or with gangrenous changes. So certainly, diabetes affects the blood vessels, whether tiny blood vessels or large blood vessels of the body.
What is angina? And how does that relate to diabetes?
Angina is pain in the heart. Now, when a person with diabetes, when that person has accumulated in the vessels the coronary vessels of the heart, plaque formation, resulting in decreased blood flow to the heart muscles. When the demand of those muscles increases and the muscle cannot get its oxygen as it demands it, then there is pain. That pain is referred to as angina. So in essence, it is as the result of partial blockage of the vessels of the heart, resulting in decreased blood flow to the muscles. And when the demand of the muscle increases and the vessel cannot supply that demand, pain results. That pain is angina.
What is the connection between diabetes and kidney disease?
That question is very important, because the diabetic or diabetes cause endothelial destruction. Endothelial means the inside of the blood vessel. In the kidneys, the tiny vessels of the kidneys are affected by diabetes, so that the basement membrane, or the membrane upon which the cells are sitting, becomes thickened. As a result of the thickening of the basement membrane and the increase of plaque within the vessels, the kidney becomes affected. That, therefore, predisposes the person to develop kidney disease.
What is diabetic neuropathy?
If one looks at the body, one finds that wherever there's a vessel, there's a nerve. In diabetes, because of the increase in blood sugar, the nerve that runs parallel and supplies the vessel becomes affected, so that not enough oxygen, if you will, enters the nerve. As a result, the nerve dies slowly because of the increase in sugar. Now, very simplistically, there's a different pathway that happens called the sorbitol pathway, in which certain enzymes are created which participate in that destruction. So when the nerve begins to die, that is referred to as neuropathy, damage to the nerve. And that happens in diabetes.
Can diabetic neuropathy lead to amputation, and under what conditions?
Now, when one has diabetic neuropathy, that means that the normal feeling that one would experience in the legs or in the feet if you were to get a prick or a cut becomes absent. Or if your shoe, for instance, is tight and it rubs against the skin, then there's no feeling there because the nerves are damaged. Because of that, now when nerves are damaged, vessels are also damaged, because the nerves supply the vessels and the vessels supply the nerves. When we have both damages, it means then that any damage to the tissue is not felt by the patient, not enough blood is flowing into the area because the vessels are blocked up, gangrene results, and because of all of this, amputation comes because there's no blood flow. So it is extremely important that people with diabetes check the lower extremities for proper blood flow.
What is the connection between diabetes and stroke?
As was mentioned earlier, diabetes affects vessels. Plaques are formed in the vessels. So if a plaque breaks off, travels to the brain, blocks a small vessel, that portion of the brain that is supplied by that vessel then dies. That's a stroke. Because when that portion of the brain dies, a portion of the body is affected. Because in the brain is a map of the whole human body. And so anything that affects the brain would affect some portion of the body.
What should normal glucose levels be before a physician becomes concerned that a person might be diabetic?
Recently, what we have done is look at what glucose levels should be. And so the fasting blood sugar level should be less than 100. If the fasting blood sugar level exceeds 100, then one should look closely and find out whether or not that particular person is not handling sugar properly. And so looking at the blood sugar and then looking at something called the hemoglobin A1C and putting those two together. And by the way, hemoglobin A1C is the percentage of sugar that's attached to the red blood cells. And if the hemoglobin A1C exceeds 5.7, but is less than 6.5, it means that that person is becoming diabetic. And so action could be taken to reverse this process.
What connection, if any, is there between diabetes and obesity?
Now we notice that where there is fullness of bread, there's fullness of body. So that as people tend to overeat and increase in girth, that is obesity. Now, what happens as a result of obesity is it means that too much calories is taken in, the blood sugar rises, the insulin within the system, even though it may be normal, it cannot carry the sugar into the cell because of lack of activity. The receptors to the cells are cups to the cells may be closed. As a result, the obese person is very likely to become diabetic because of inactivity, increase in calories, increase in blood sugar, and high blood sugar levels within the body system.
If you were to make a recommendation to the general public or to a person who has diabetes, what can a person do? Okay. What would your recommendations be to the general public to prevent diabetes, and what would your general recommendation for people who have diabetes who might want to reverse it?
Interestingly enough, the recommendations for both people are the same. Now, if you were to take your plate of food and you look at it very closely, if all the food in your plate consists of one color, then there's something wrong with your eating. At least 50% of your plate should be vegetables. The other 50% of your plate should be protein and possibly carbohydrate, or fruit, carbohydrate and fruit. Now, what that does, when you look at what I've just said, is it means that your caloric intake is reduced. So reduction in calories, that's one factor. The other is exercise. Now, exercise is it's better than a pill. What it does, it increases nitric oxide from the vessels. It enables you to burn up all the calories that you take, and as a consequence of that, reduces your blood sugar. So with exercise, proper diet, that can prevent you from becoming diabetic, and if you are diabetic, then it can reverse to some degree your diabetic situation. So diet and exercise, those are two things that are very necessary for preventing diabetes, proper diet that is, and reducing the blood sugar in the diabetic, or in reversing, in some cases, the problem of diabetes.
In finalizing this interview, what would you say was the major cause for diabetes in America today, and why is it so difficult for people to manage all of the variables of weight, exercise, what to eat, what not to eat, pills, insulin, metformin? What's the biggest hurdle to a person managing all of those things?
The biggest hurdle is food. We live in a society where food is readily available, all kinds of food, especially food that's with high fat content, high sugar content. And when one is accustomed to one way of eating, it is extremely difficult to change. Therefore, one needs to understand that to prevent a disease like diabetes, there should be stricter control of one's diet. If one controls one's diet very strictly, that reverses a number of problems. Now that's one aspect, and the second aspect is exercise. We have become a sedentary society, but the good news is that more and more people are going to the gym today. More and more people are walking. So there's light at the end of the tunnel for some of the things that we're experiencing. So get up from the couch, take a walk outside, and watch your diet.
Thank you. That's it. That's a home run.